I don't know if I'm on camera here. I'm a Russian kid and I have a bunch of books on my wall. One of them is Ben Horowitz's book called What You Do is Who You Are. And I say that because we thought about our culture early on, and then we observed our culture and rewrote it. And so I say that when we started the company, there were a certain set of events that compelled my co-founder and I to distill our set of beliefs, believing that that is our culture. And then, kind of posting it on our website and chatting about it with our colleagues and employees. But at the end of the day, as you kind of get into the rhythm, so to speak, your culture is the set of behaviors you exhibit.
And now, from San Francisco and the UCSF Rosenman Institute, the Health Technology Podcast with your host, Christine Winoto.
When patients leave the hospital, they often face a dangerous gap in care. The system with outdated methods and heavy paperwork leave them at risk for complications, repeat visits, and needless stress. Every day, many worry about returning home without the clear, compassionate support they need, and the burden falls on both patients and overworked care teams. Today, we highlight a leader who turned personal loss into a mission for change. Yoni Shtein, the CEO and co-founder of Laguna Health, brings a blend of technical skill and business insight. From his early days in software engineering and high-stakes finance to confronting very human challenges. After the sudden loss of his mother-in-law, a tragedy that sparked his drive to improve post-hospital care, Yoni set out to build a solution that bridges the critical gap between hospital discharge and complete recovery. Laguna Health has earned special recognition as the ADAPT awardee from the UCSF Rosenman Institute for its innovative approach to care management. Their breakthrough AI-powered co-pilot has also been honored with a Time Best Inventions Award. In addition, their work has been validated through strong clinical research partnership with renowned institutions like Mayo Clinic and UCSF, and their collaborations with Elevance Health underscores their growing impact on care transitions. In this episode, we explore Yoni's journey from personal loss to healthcare leadership, discuss the evolution of Laguna's Health groundbreaking technology, and uncover the insights that are changing how we think about post-hospital recovery. Here's our conversation. Welcome, Yoni. Thanks for joining me from Tel Aviv.
Thank you so much for having me.
It's so fun to have you, and it's been our honor and pleasure to have you as part of our Roseman community. And I always like to start our conversation with how you get started and what inspires you to be in healthcare and the journey that takes you to where you are today.
Yeah, no, of course. And thank you for being here. It's been nothing but a privilege being part of the community here for the last, I think, 3 to 4 years now, a very transformational years for us. And kind of in the spirit of transformation, just maybe connect a few of the dots that got me and my co-founder into healthcare. I would say kind of the several points would be one, my co-founder, two, my family life story, and three, a profound mission drive to do something positive in the world. And I'll kind of dive deeper into the 3 points. My co-founder, before Laguna, co-founded a digital health startup called Vim years back. So as we got into launching Laguna, we're specifically exploring opportunities in healthcare, certainly kind of trying to leverage that experience and product insight and capabilities. I would say that's one. Two, sadly for me, and typically for annoyingly many digital health entrepreneurs, I lost my mother-in-law several years before launching Laguna. Post-hospital discharge, long story, not the point. The point is, it was a very traumatic point for me. It came out of the blue for my wife and I, and kind of really shook us to the core. And I, at that point, was working in finance, kind of the polar opposite of healthcare, or building kind of meaningful, value-oriented solutions in healthcare. And kind of from that point, really was energized, if you will, to pursue something of meaning. And last but not least, I would say kind of to the meaning part, building a company that is doing something positive in the world, just as a general statement, has been something that has been a dream, if you will, a mature, immature, call it as you call it, of mine for many, many, many years. And I think it took me and Yael, my co-founder, years to kind of talk about maturing, to ripen to it and build the necessary and complementary experiences so as to launch Laguna with the right mission, the right set of experience, and the right probability of success, if you will.
Mm-hmm. You mentioned earlier that you were in the finance world and now you're in the healthcare world. There's a lot of learning that you've done, I'm sure, in the finance world. What are the things that you felt that was a very valuable experience that helped you to achieve your dream that you say right now?
Yeah. Perhaps surprisingly, but many similarities. And you know, the reason I say that I keep telling people that healthcare is a very businessy business. Different businesses, different industries are driven by different things. Could be the economic incentives, could be the product, could be perception, could be macro, micro, tailwinds, headwinds. I can keep going. What's fascinating about healthcare is from the outside looking in, it looks like a, I don't know, kind of clinician's world or an insurance world. But I think kind of, and they all certainly play a big part in kind of the payer, provider, patient ecosystem. But as you lean in to start analyze pain points and you venture to build something of value, understanding pain points and quote unquote the business flow of who cares about what and why, which may be aligned or misaligned with what they may be saying, and that is okay. Even that quote unquote misalignment is part of the game or of the challenge. And so being able to decipher those business and finance nuances is really hard. It is more of a business finance challenge than a product one. And so actually, like for me, spending a decade more in the business and finance side of the spectrum and coming into healthcare and partnering with my co-founder, who's a product and tech whiz, was very much needed in the healthcare industry, right? Because we say healthcare, we think it's about delivering care, which it is. But as you venture to build something, understanding the business context in which you're in is of critical importance in this industry, in my opinion.
Which is maybe a good way for us to segue. Tell us a little bit what Laguna does and how is that what you learned that you're saying that the business finance, that is somehow that you understand that unlock the opportunity for Laguna to address and deliver the result that you need to do to impact the patient's life.
Absolutely. And I think he'll connect not just to kind of past learnings, it will also connect it to Laguna's journey. I keep, saying the following with a lot of humility. You have those entrepreneurs who are born kind of clairvoyant with a prophecy. Just wake up and like you see the matrix. That was not us. we had to bleed to get to this point. And I take a lot of weird, if you will, pride in the grit and critical lessons that were learned that enabled us to unlock a very strong PMF, product market fit. So I'll do a quick one-liner on what we do now, where we found PMF and value at scale, and then I'll spend maybe a few minutes on the journey that got us here and on the learnings that we're learning and evolving, iterating, pivoting, whatnot. What we do now, Laguna, is a Gen AI co-pilot for care managers in health plans, health insurance companies, and virtual care organizations. That co-pilot helps them to be more efficient in their day-to-day workflow without having them change the workflow change the technology stack without having them change their clinical model. We learned that change management is a big deal and you have to meet the market where it's at. And we're able to build a product architecture that enables an incredibly easy lift, would be the industry jargon, and drives that efficiency and satisfaction for our users. And of course, now Gen AI is very much in vogue. And maybe a quick word on care management is essentially the clinical, to put it in simple terms, call center function of health plans and virtual care organization that deals with a sicker and more expensive population that needs more of a high touch, if you will, service. Now, I'm happy to kind of revisit that. It's super exciting and we're getting a lot of recognition in that space. But we did not start as a kind of sexy, techie AI company. We started in 2020 in the heyday of COVID. That was, COVID started Q1 to whatever 2020. And that changed many things on many fronts in healthcare, obviously. We were very interested in the post-acute recovery space. Why is that an interesting space? Because COVID was frankly pushing a lot of people out of hospitals early. Hospitals were looking to free up beds. People were running away from hospitals, you name it. They were being discharged, would be the technical term, early, which sadly was increasing readmissions. Readmissions are expensive and maybe unnecessary. And so we thought at that point, oh my God, it's everybody were talking about it. It seemed like the most important problem in the world, seemed like a genuine pain point. If only we were to solve it, everything will be better in the universe. And so we launched Laguna at that point, focused on the care management of post-acute recovery. So I would say the good news is that we did solve the problem, as evidenced by multiple randomized clinical trials with the Mayo Clinic, North Shore, a huge pilot that we've done with Elevance, thanks to you and UCSF. And we're able to solve it with a brilliant care model and care team and purpose-built technology. That's the good news. The business learning is that we learned that episodic delegation of care management doesn't work, as it's known, and I can kind of dive into that. And we learned that, candidly, our comparative advantage is much more the technology versus the care delivery. And at that point, we started learning a lot, obviously, about how care management is done, and specifically how the payer or health plan or health insurance company care management is done. And that enabled us to kind of advance to focus on kind of our second hypothesis at that point, which is traditionally care management is hindered by legacy AT. And legacy AT, for a second, please do not take that as me being kind of facetious, is the reality of enterprise AT. It is really difficult to move as a startup when you're an enterprise. And, hopefully when we grow and we become a large enterprise, as funny and annoying as it may sound, you will probably also be moving very slowly so as to not break anything or regulation or whatnot. And so at that point, we evolved to building care management technology, or specifically kind of this modern, integrated, beautiful CRM, to put it simply. That was also amazingly effective and efficient and loved. But then we learned two additional important lessons, one called implementation and the other one called replacement cycle. Now, implementation means that whatever you build, someone has to call in IT. And IT, as my CRO likes to say, is just not sitting around and looking for something to do. And so for them, if it's anything of consequence, they'll say, yeah, we can get to that in Q2 2027. And then you're kind of waiting for years, obviously. And replacement cycle means that even if what you're selling easy to implement, if just the buying cycle, the period at which they buy it, is every other decade, it sounds like I'm joking, I'm not, then you're waiting again. And so that, like, taking all of these, to your point, like business and finance lessons, enabled us to build a solution to a pain point that meets the market where it's at. And where the market is at is the payer, virtual care company, care management. Talk about enterprise IT. Our average user sits in front of 2 to 3 screens, staring at 6 or 8 or 10 systems, because welcome to the spaghetti of enterprise IT. They have multiple systems. multiple systems. They have to stitch together all the data before they interact with the individual. Talk about interact with the individual. Care management on the payer side is longitudinal, meaning it's a repeat encounter. And so, annoyingly, if you will, most of the day is spent on, as it's known, prep and rep, getting ready for an encounter and doing a variety of follow-up action items to the tune of as much of 75% of the day. Or to put it differently, they utilize only 25% of the day doing actual member engagement. That's kind of the actual work, right? And so, and mind you, these are clinicians. 80% of care managers are nurses by trade. They're people who chose this profession so as to help people. And instead, they take a lot of notes on many CRMs. And so they're unhappy about it, to put it mildly, not as effective as they could be, often burnout, turnover, everybody loses. And we're able to build a solution, again, kind of built on all these learnings along the way that meets them at their existing workflow, their existing technology stack. They don't need to change anything. It meets them on the same pane of glass, would be the kind of product terminology. And a system, it starts at kind of what is now known in the industry as ambient listening, automating, obviating the need to take notes. But we went way beyond that in building two large language models that are, to put it simply, a bit of a driver assist and provide real-time guidance, both on what the member is saying and providing insights on barriers and pathways, critical kind of engagement levers for them. And the other one provides feedback and training and observability for the user care manager and the supervisor. That is the product that super excitingly won kind of that Time Best Inventions award. And the supervisor is the second user. We kind of discussed the meeting the market where it's at. That's an additional critically important stakeholder that has to oversee that team and now painfully has manual tools to sample calls out of thousands a month across the team that they have. With Laguna, they get 100% real-time observability, and they can really focus on helping the people that need help so as to perform better. Let me pause there.
So does that mean, like, tell me, like, who is your user now? Who are what kind of organization? And you mentioned there's so many different systems. Is it now the Laguna replacing that system, or just add more to the system?
Thank you. God forbid replacing. No, we're not replacing. I'll start from the second question. We're not replacing because replacement is really hard. It does not happen frequently. And replacement is difficult from an IT standpoint, and replacement is painful from the user standpoint. Even if it makes everything better, it's change. And change is scary. It's as simple as that. One of my biggest, kind of talk about business and finance, one of my biggest learnings along the way is actually empathy to the user's emotion and day in the life, as they call it. Change is hard. And so what we do, the way you help is by taking quote unquote low value work away from them. To put it in healthcare speak, you want to help your users, the care managers, coaches, case managers, claim specialists, navigators, different names for the same persona, essentially, practice at the top of the license. What that means is help them do what they love, what they were trained to do, and where they shine and they're most effective. And everything else that you could kind of augment and delegate to a machine, so to speak, happy to delegate and augment you, the individual, to do your best work with your members. We call it on our website, making care more human, because now the administrative load, the cognitive load is actually hindering the humanity and effectiveness of care because there's so much administrivia you are burdened and have to do for documentation and a variety of other regulatory painful reasons.
It's interesting you mentioned about finance, like you learned that finance about change. Nobody likes change, but I remember my time when I was in finance. I feel like there's lack of empathy.
Yes. Finance is much more transactional, to put it mildly, than healthcare. But I think the beauty is that if you're able to fuse together is to combine some of the learnings and strengths from finance into healthcare that is much more mission oriented and ambitiously member centric, which is a beautiful thing, and human centric. So if you're able, I think, to take the learnings from kind of interdisciplinary, if you will, skill sets, I think it is critically important in healthcare.
And tell us a little bit now in terms of your running a company. What are your lessons learned from when you're from 0 to 5 to 10 to 100, like, growing your company? How do you grow your company? How you maintain that culture or create the culture that you want that is conducive to the growth of the company?
Wow. The first one is probably a book-long answer. Let me digest it and kind of try to synthesize it to a few punchy points. Let me maybe start with a second point that is easier, and we had to think through that meaningfully, and I think we've done a decent job. I don't know if I'm on camera here. I'm a Russian kid, and I have a bunch of books on my wall. One of them is Ben Horowitz's book called "What You Do Is Who You Are," and I say that because we thought about our culture early on, and then we observed our culture and rewrote it. And so I say that when we started the company, there were a certain set of events that compelled my co-founder and I to distill our set of beliefs, believing that that is our culture. And then, kind of posting it on our website and chatting about it with our colleagues and employees. But at the end of the day, as you kind of get into the rhythm, so to speak, your culture is the set of behaviors you exhibit. I often give this kind of funny example, like you and I, we could be talking about poverty in Africa, hypothetically, all day long. And then what do? We sip coffee at my favorite coffee shop, Phil's, and that's all we do. So we're probably doing nothing about poverty in Africa. We like to talk about it, which is great, but from an action doing standpoint, close to nothing. So that means it's not a value of yours. It's a vanity, if you will, value. Very different. And so a few years into the company, we kind of paused to reflect how we do what we do. What do we do? What characterizes people who are successful at Laguna? What characterizes people who are unsuccessful at Laguna? And that enabled us to distill 5 values that we think resonate quite well with us and reflect us and successful people at Laguna. The 5 are care deeply, give a damn about the company, about colleagues, about members, customers, users, a lot. Care profoundly about that, number 1. Number 2, love to learn. It's a forever changing industry and sport. You need to love the change and growth and evolution. Solve with creativity is our 3rd value. And it's a bit of a dual one because if it's solved already, use the best practice. And if not, use your whole toolbox. Be as creative as necessary. 4, as you can tell from the style, keep it real. I think balancing respectful, constructive conversation with efficient, directive style is vitally important to not beat around the bush, but also to not be blunt and disrespectful and hurtful. And last but not least, achieve more together. This is a marathon. This is a big challenge that we're tackling. It's more than one, it's more than 2 people to do that. Instilling a culture that celebrates collaborative accomplishments, collaborative environment is critical because the other one is toxic and unproductive, to put it kind of in nice, gentle language. Yeah, so I would say that is the culture. Culture is what you do is who you are, the sum total of your actions. And if you act consistently with that as a founder, it is more likely than not, then the rest of the company will emulate, so to speak, you. That's a big one, just to the company building point. I think a natural extension from culture is people. Hiring well is everything. Hiring well does not guarantee success, but oh my God, does it make it easier? And the polar opposite could be said about not hiring well or hiring poorly, as defined by you. Outcome, culture fit, you name it, work style. It just makes it that much harder. And then I have a lot of kind of thoughts and comments about the journey to PMF. But candidly, I'll shout out to a non-investor of mine, but I just admire the work they've done. First Round Capital, they have this huge chapter on the website on unlocking product market fit, and it's just so neatly structured and explained. I would say that's kind of at the 0 to 1 stage, at least. I think is critical to be very thoughtful about your experimentation. And I'll kind of double click on that word and I'll kind of wrap up there. I used to take offense with kind of the iterations and experimentation. What do you mean? Like, you as a founder, you should be born clairvoyant and know everything. Nobody's born clairvoyant, period, full stop. It just seems that the other person is. And that is probably an optical illusion. And so you want to be very thoughtful in your evolution and iterations on the business side, on the product side, and on your emotional stamina in the process to not get discouraged, because it's hard.
What do you mean by being thoughtful? Thoughtful, is that being intentional? Everything what you do has a purpose that you thought through. Like, if I do X, this could be the implication, and this would be the data that I'm trying to achieve by doing X, Y, Z.
Yes. What I say is, and again, kind of, I want to say kind of the following with a lot of humility. Even though we started Laguna with quite a bit of experience behind us, still a lot of what I'm saying we had to learn the hard way, as they say, which I think, by the way, is like the only way. But whoever they is, they say it's the hard way, as if it's so easy for someone. Which means you learn by doing. But so learning by doing, you want to be very intentional about what are you doing and how do you measure success. Because if you don't define in advance, well, we're going to do this quote unquote experiment, or we're going to run this sprint in the next week, month, quarter, year, whatever. And then we will measure success and attribute success and failure to these or those variables. Then you kind of cement, well, I know that X, Y, and Z work very well, as evidenced by that, but ABC, not so much. And that way you're able to kind of turn cards on the table of confidence, of conviction, or to put it in investor speak, of de-risking different aspects of the business. And you want to be very methodical about it. Now I'm de-risking this part. Now I'm de-risking that part.
Mm-hmm. And one of the things, as you mentioned, learning the hard way. There's no such thing as learning the easy way. What are some of the lessons learned that you found that was so hard on you, but yet so meaningful? Oftentimes that things that's really hard are the most meaningful lesson, right?
Two big ones come to mind. One is what I used to call spoken priorities versus practice priorities. And the other one is signal versus noise. I mentioned earlier that healthcare is a very businessy business. And I think it's somewhat of a misleading industry. If you and I were to go to the tobacco industry, arms industry, you know what's up. You know what I mean? You know what the industry stands for. And if that is aligned with your values, power to you, and you get it when you walk into the industry. Healthcare, I think, is more complicated because I think on the surface, it is very much a make the world a better place industry, but in reality, it is an industry. And so I'm now hooked for life, right? Because here, even if by mistake you do something meaningful and good in the world, But it's not only that. There's multiple layers to that. And so I say that a painful and a profound learning for us that to my kind of readmission, recovery, care management days, while people may have quote unquote spoken priorities, flags, banners that they, kind of raise, XYZ is really important for us. It may or may not be. What they really buy on and practice is what I call the practice priorities. Where did the dollars go to? Now, you, the innovator, again, like there's no room for sarcasm or cynicism here. Truly, by the way, I think it's like poisonous in entrepreneurship. So put that aside. But nevertheless, you have to appreciate why your buyers say what they say from a spoken priority standpoint, why they buy and allocate resources and priorities as they do at the practice priority standpoint. And when you innovate and position and market and sell, you have to meet them at both of these dimensions. You have to speak to the spoken priorities because it's important. And you have to sell and drive value to the practice priorities because if not, you're out of the game. Making that distinction took us time and nobody kind of tells you, hey, by the way, you want to pay attention to this and that is painful. And I think it's critical. So that I think is one big lesson. The other one is what I call signal versus noise. And I think it's a very kind of personal and emotional, not kind of personal necessarily for me, but I think personally in the founder's journey, the hero journey, as they call it, evolution, because you're so swamped with noise. And I'll be more blunt. You're so swamped with, you're never going to make it. Noise. I love silly comedies. One of my silly comedies that I love with John C. Reilly is Walk Hard, the story of Dewey Cox. Is like it's a Johnny Cash kind of type of movie, and his life for his whole life, even when he's successful, keeps telling him, Dewey, you're never going to make it. Somewhat discouraging when he's your closest partner. But so the world is, when you're the innovator, the entrepreneur, the founder, the world, hopefully your partners are more supportive than that, but kind of everyone else, most else are on the spectrum. And what's fascinating is that most of them are complete noise, disregard. But those diamonds in the rough, 1 in 10, 1 in 20 says, hey, Christina and Yoni, you may not make it because of this, but if you change that, you will. And the thing is that signal versus noise, it's not as if the single signal self-identifies. Hey, Christina and Yoni, I'm a real input for you. I love you. I want to help you. Please, follow my advice. On the surface, they sound quite similar. And it's so freaking hard for you to not get discouraged, to seek more, to go deeper, and to categorize, so to speak. Is that a noise? Doesn't matter. And by the way, doesn't matter mentally speaking, and then doesn't matter emotionally speaking. Because guess what? The signal and the noise take a toll on your emotional battery. That is not an infinite resource. Hopefully you can recharge it. Hopefully you're blessed with elephant skin or whatnot. But by the way, to that end, elephant skin could block you from hearing the signal. So it's more complicated than that, right? You need to be able to filter out the noise mentally and emotionally to not let it discourage you. But then when you hear vital information, vital feedback, use it and grow. Again, easy to say, really hard to do mentally and more so emotionally, which I think is a aspect that gets usually, right, in the last several years, I think have gotten way more attention to mental health. But I think kind of the innovators, entrepreneurs, mental health or emotional health usually gets very little attention because people probably think, oh, you're building a business. You knew it was hard. You should not complain or whatever. It is really hard. It is really hard. And again, like different people deal with it differently. But yeah, you should not get discouraged.
You mentioned it's easier said than done, just like everything else in life. I guess my question, what do we need to be aware of ourselves? What kind of awareness that you need to have in order to sift through all that haystack to find that needle?
I think you need to be really driven. 1. 2, I think you need to be loving the journey. I think if you're driven is a independent statement from the journey, I think. Because I think if you're driven by the wrong thing, that drive could disappear, not last. They say that companies die when cash runs out or kind of the founder battery runs out. To me, both Yael and I were kind of blessed in really loving the journey, the climb, the struggle, as Ray Dalio would put it. And now it doesn't mean that you'll love the pain. It means you're certainly kind of not suffering too much from the pain. You need to take it with stride. But more than that, to your point about a framework, there's so many books, so much knowledge. None of that guarantees a thing. I think what guarantees a thing, if you read none of that, it kind of guarantees your failure. And so my point is, you need to love to learn. You need to love the discovery. You need to love the struggle, as funny and weird as it sounds, because that's the game. And by the way, I don't know that it ever changes. Like, you've gone 0 to 1. Guess what? You're now going to struggle 1 to 10. It's not as if 1 to 10 is easy. Higher and different expectations and different challenges, bigger challenges on many fronts, and so on. And so my point is, being driven, I think, is insufficient. You need to really love the journey, and loving the journey has several, I think, specific factors. Seek help, seek advice, seek mentorship, read a lot, whatever that may be for you. First Round's website. I mentioned I'm a Russian kid. I love books, and there's so many amazing books. Podcasts. Really, it's a blue ocean, very deep, up to you. And I think if you're swimming and not giving up, you're already ahead of the game, or at least you have a fighting chance.
Well, I really want to thank you for sharing this insight, and I'm very excited for the progress and all the accomplishment that you and your team and Yoni is doing. And it's always give me a lot of smile to see the progress and the impact that you've made in healthcare.
Very much thanks to you and UCSF. So thank you.
Thank you.
Thanks for having me.
Thank you for tuning into today's episode of the Health Technology Podcast. We hope you found the conversation insightful and inspiring. If you enjoyed this episode, please take a moment to subscribe, rate, and leave a review on your favorite podcast platform. Your feedback helps us continue bringing you the latest in health innovation. Stay connected with us on LinkedIn and Twitter for updates on upcoming episodes and more. Until next time, keep pushing the boundaries of what's possible in healthcare. I'm Christine Minato, and thank you for listening.